Hello and welcome back to the second episode of our Maya's Cocktail series. Again, I'm your favorite nurse, I'm hoping, Nurse Amy, back on your screen. And today we're just going to continue from where we left off. When we talked about the Maya's Cocktail, I told you how very popular it is in the spa here. It's like everybody loves to get it. I, for one, I have tried it myself. I love how it makes me feel. I love the feeling of not only being hydrated, but getting those B vitamins and the minerals. It actually goes a long way to put me in a good place. I kind of like it. I also like magnesium. And the reason why I like magnesium is because I have to watch my blood pressure. You know, the tendency is for it to go high, and I've got to be very careful how my blood pressure doesn't spike. So I am a great beneficiary. I essentially love how it helps me decrease my blood pressure. So, and that's something I also discuss with my clients. However, if it is something the healthcare provider, the physician says is okay for them, then I essentially tell them it's a good thing to get. If you have high blood pressure, you can go ahead and kind of, have that as part of your IV hydration. I don't know any of you have tried to take magnesium oxide pills. I don't like it. I essentially don't really like taking pills. I'll take it if I have to, but I'm so glad for IV hydration. So enough of that about me. Okay, enough of that. So let's talk about the benefits of Maya's cocktail infusion. Now, remember the last time when we talked about Maya's cocktail, I essentially gave you some of the ubiquitous components of the Maya's cocktail. And that is, it's got vitamin C, it's got the B complex vitamins, including vitamin B12, it's got magnesium, it's got calcium, it's got zinc. I remember in other series I've done, I talked about the benefit of zinc, I think. Again, that's something I'm also going to have a series and just talk about it. And then we've got the glutathione, which is like the mega antioxidant, is like the grandmother or grandfather of all antioxidants. So these things, all these minerals and vitamins, micronutrients are really, really great in Maya's cocktail, and that's why one of the reasons why it's popular. Sorry about the cough. If there's something you didn't catch in my talk, just type it down and I'll go over it again. So depends on where you go to get your Maya's cocktail. I also mentioned that in last time. No, there's no one fixed Maya's cocktail, one size doesn't fit all, right? Depends on what you and your healthcare professional has agreed to. So what are the benefits? So the benefits, different strokes for different folks. Magnesium has been known to reduce asthma attacks, chronic fatigue, cardiovascular diseases, fibromyalgia, chronic sinusitis or sinusitis, rhinitis or rhinitis, upper respiratory tract infections, migraines, and so much more. I'm telling you, Maya's cocktail is popular for a reason. It seemed to target all those chronic issues, acute issues, things that you just want to get rid of and you just want to bring your levels up. The Maya's cocktail is a cocktail of different vitamins and minerals, and it just comes together to put things in where they need to be. Magnesium and vitamin B may increase the efficacy when paired together for those who suffer from cardiovascular diseases. Again, these are studies that people have come up with. You can do your own research, find out what is good for you, and then if you have questions, ask your healthcare provider. There are also indications that vitamin B6 with vitamin B12 may relieve muscle weakness associated with hyperthyroidism. So those who suffer from acute muscle spasm, poor sleep at night, or high levels of stress may have a magnesium deficiency, and so they also may benefit from receiving intravenous treatment to bring the magnesium level to an optimum state. One thing I can say for me, whenever I get my Myers cocktail, I sleep very well. I sleep like a baby. It just puts me in the zen feeling. That's my take from it. And when I ask my clients who are repeat clients who keep coming and they still want, again, there's so many other, the plethora of treatments they can get, but the Myers seem to be a staple. They can get others for beauty, for energy, or some of the other ones that we have, but the staple for them is this Myers cocktail. Is they're like, I want to take this. So that's been my experience so far. And then how often can you get it? Again, it's interesting. The reason why I want to go over this, one size doesn't fit all. So how often you get it, essentially it's your goals, your health status, your medical history, and what you and your healthcare provider have decided is good for you, because it's essentially a lot of time is tailored towards you. So it's like a buffet table, like I told you guys. You have all these things that you can add into it, but they're all not for you or good for you. Again, it also depends on the medications that you're taking. How does it affect you? So sometimes people get it every week, people get it every month, every 3 months, every 6 months, so it essentially depends on what you want. Now, let me explain that. Let me go ahead and expatiate on that. In some cases, optimal health results may come from 1 IV per week over 3 weeks. Now, if the patient is severely fatigued or has persistent migraines, 2 treatments per week may be better to serve those needs. Some patients may benefit from occasional treatments every 3 to 4 months to support immune system. So again, it's what you and your doctor come up with, a good treatment regimen. Okay, so some people, suffer from certain diseases, and they start more frequent just to get them to that optimal level where your body it's built up to fight those ailments or those chronic conditions. Again, it's all about optimal health. It's holistic. I see it as a holistic way of taking care of you. Okay, so it's not just you popping pills, but you want to take care of your mental, your physical, your emotional, all of that. Part of it is getting your micronutrients and your macronutrients up to par. So it essentially depends. Okay, so yeah, so that's where I want to stop this particular episode. We'll talk about, again, I'm going to go over Myers cocktail. We're going to talk about side effects, when you come in, what do you expect, and things like that. And please, please, please feel free to ask me questions so I can directly target those questions and give you targeted answers. So I'm hoping that you're going through this different episodes is kind of helping you, because my desire is actually to help you make informed decisions about taking IV therapy. So until I come your way again, be safe, be kind. I'll see you in my next video.